Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 8:20 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM, and 1050 AM in Lynchburg, and Wednesdays at 1 PM on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. Today, we're excited to be joined by Dr. Seung Lee, a transplant surgeon who is Associate Surgical Director of Liver Transplant and Living Liver Donor at VCU Health Hume Lee Transplant Center, for a conversation about his work, liver health and transplant, and more. With that, welcome to the show, Dr. Lee. Thank you for being with us.
Hey, how are you? I'm very honored to be here to speak with you today.
Thank you. So, as a rule, we like to start these conversations by getting to know our guest a bit more, which is often a biographical trip down memory lane. In your case, Dr. Lee, before becoming Associate Surgical Director of Liver Transplant and Living Liver Donor at VCU Health Hume Lee Transplant Center, you earned a medical degree from Seoul National University and trained at Seoul National University Hospital, the National Cancer Institute in South Korea, and UVA Health System. You are a recognized leader in living donor liver transplants and minimally invasive liver surgery. Outside the clinical setting, you are a family man and father of 3 children. But there's another aspect of your story that intrigues me: how watching your mother struggle with severe arthritis as a boy inspired your medical career and informs your approach to patient care today. Tell us about that, if you would.
Yes, when I was a child, and then my mother has very severe arthritis on her both knee, and then she's not working well, and then she's not making any food for us because she had a lot of pain every day. So I watching her, every day until the middle school and high school age. And then at that time, I really want to be a doctor, and I want to cure the patient like my mom. That's why I want to be a surgeon, and then I want to operate the patient and then to fix the problem with my hand. That inspired me to be a surgeon like now.
Thank you so much for sharing that. This podcast has hosted several guests affiliated with VCU Health who specialize in treating liver disease, including Dr. Arun Sanyal and Dr. Jasmohan Bajaj, who have each shared their insights and experiences as physicians working with liver patients, including research indicating a linkage between cirrhosis and cognitive decline. From your perspective, Dr. Lee, could you tell us about the importance of the liver in the body and the critical functions it performs?
The liver is one of the most vital organs in our body. It performs essential functions like the filtering toxins from the blood and aiding in digestion by producing bile and storing the vital nutrients. The maintaining the liver health is crucial because the liver disease, such as hepatitis, fatty liver disease, and cirrhosis can significantly impact our overall health. So it's very important to adapt a healthy lifestyle, and including the balanced diet and regular exercise and limited alcohol consumption and avoiding the risky behaviors like some drug overuse, which can protect the liver from the damage.
So, October is National Liver Awareness Month, a time where people are encouraged to find out if they are at risk for fatty liver disease. Fatty liver disease affects an estimated 80 to 100 million Americans and is present in up to 75% of overweight people and in more than 90% of people with severe obesity, according to the American Liver Foundation. Dr. Lee, can you provide a brief overview of fatty liver disease and its symptoms and signs to help educate our audience?
So, the fatty liver disease is the most common disease in the liver for nowadays. And then the problem is there is no significant symptoms in the early stage of the fatty disease. So always you can find the liver disease at the end of the phase. And then it's going to the liver cirrhosis, and then ultimately can make some cancer inside your liver. So if you find the liver disease in your body, maybe a little bit late. So I think we can recommend, you can check the liver health with getting the labs, every year. And then also sometimes, the provider recommend some liver ultrasound to check the liver if they have the fatty liver or not. So you have to follow those kind of things, and then you can change also the healthy lifestyle, something like that. So once you have some liver cirrhosis and liver cancer, so you need to see the provider and see the options. You might need some surgery or some medicine to reduce the fatty infiltration inside of your liver, or you might need some liver transplant, like our patient population, something like that.
Thank you so much. A few moments ago, we referenced how personal experience has informed your approach to treating patients like family. With that in mind, can you tell us more about your work as Associate Surgical Director of Liver Transplant and Living Liver Donor at VCU Health Hume Lee Transplant Center? How do you apply that patient-centric care philosophy in that role?
So when I went to the medical school, I saw many liver patients who suffering the yellow eye and then a lot of ascites inside the belly. And some patients have some bleeding a lot through the mouth and below. At that situation, I saw the liver transplant operation, and the liver transplant is amazing. The treatment, it can change the life with only one surgery. So this very sick patient has come to the hospital, and then the patient got the liver transplant, and so day one after liver transplant, the face is totally changed. It's shining on the face. So that makes me to be a transplant surgeon. Now I'm doing more doing the liver transplantation. Also, I'm interested in the living donor liver transplantation because there is some liver shortage in the United States. So if there is some sick patient requires the living donor liver transplant because they are not on the high list on the high rank on the list to get the deceased donor. So in that case, if they have any potential living donor, and then you can see the patient at the hospital. And nowadays we are providing the robotic surgery for the donor, so you can make a very small incision for the robot, and then you can take the liver out below the waistline. So there is no more deep scar in the abdomen for donor, and donor usually can go home very fast after surgery and then get back to the work as well.
Last year, you and your colleagues at the VCU Health Hume Lee Transplant Center launched an innovative, less invasive robotic liver procurement procedure to expand the pool of eligible living liver donors. Virginia is one of 25 states with medical centers that perform living donor liver transplants, according to the Organ Procurement and Transplantation Network. It's my understanding that you traveled with Dr. Vinay Kumaran, who has also been a guest on the show, to South Korea, where living donor transplants are more common. So could you share more about this robotic liver procedure and its benefits for patients?
Yeah, absolutely. The VCU has some pioneer program that utilize robotic technology for living donor liver procurement. This advanced approach involves using the robotic arms and high-demand cameras to perform the precise surgical maneuver through the small incisions. The benefit include minimal scarring, reduced pain, and a quicker recovery time for donors. The robotic technologies allows us to maintain high precision, reducing complication, and improving the outcomes for donor and recipient as well. This innovation is a significant step forward in minimally invasive surgery and position VCU Health at the forefront of the transplant technology, because there is only few places in the world can do the robotic donor hepatectomy.
Earlier, you shared insights about the liver's many jobs, including storing nutrients, removing waste products and worn-out cells from the blood, filtering and processing chemicals in food, alcohol, medications, and more. What general advice would you offer to listeners to protect and promote liver health?
So, as I told you, it's very important to adapt the healthy lifestyle, and including the balanced diet and regular exercise and the limited alcohol consumption, and also avoiding the risky behavior like some, unsafe drug use, something like that. So it can protect the liver from the damage, I think. The most common liver disease I encounter, including the liver cancer, cirrhosis, and hepatitis, and non-alcoholic fatty liver disease. But this kind of treatment is very various depending on the disease type and stage. But you have the many options for the treatment for that. And then if you have any concern about the liver disease, just come to the VCU Health and then we can fix the problem.
Thank you so much for being with us today. Before you go, we do have a tradition on the Patients Come First podcast to ask our guests a pair of fun personal questions. To keep things interesting, we have a list of 10 mystery questions. So why don't you choose 2 numbers between 1 and 10, and I'll ask you the corresponding questions.
7?
Number 7.
Yeah.
If you could choose one superpower to have or any one skill to instantly master, what would it be and why?
So, I want to be a surgeon still. If I have some skill to cure the patient disease, so, with my hand, with my body, still I want to be a great surgeon to fix all kind of the patient problem with my hand. That's my hope.
Awesome. Thank you so much. And do you want to choose one more number?
Number 1?
Number 1. In the hypothetical scenario that you could anticipate your final day on Earth, what would your last meal be?
The last meal is probably kimchi. I'm from the South Korea, so South Korean like some kimchi a lot. So I'm eating the kimchi every day. It's very healthy food. So maybe the last choice is the kimchi.
Thank you so much again for being with us, and that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guest, Dr. Seung Lee, for joining us today. So thank you.
Thank you.